We must win a set of arguments to defeat big government socialism. By big government socialism, I mean the fanatical belief on the American left that claims a better, fairer future can be created if a gigantically powerful government controls or owns production and is guided by massive bureaucracies of professionals who focus on process rather than achievement. This is not the idyllic, pseudo-utopian, and fictional Scandinavian-style socialism to which American progressives like to allude. It is a big, formidable, technologically enhanced version of socialism which has roots in the system that was developed by Friedrich Engels and Karl Marx, and brutally imposed on people by Vladimir Lenin, Joseph Stalin, Mao Zedong, and other ruthless tyrants. First, we must win the argument that big government socialism is not working. This should be the easy one. For the last year and a half, we have had vivid proof of this. Big bureaucratic government has proven it can't control the border, reduce crime, withdraw effectively from Afghanistan, modernize fast enough to compete with China, get schools to educate effectively, cope with the challenges of a pandemic, or perform a litany of other duties vital to our survival. Again and again, we are witnesses to systems not working. The degree to which big government socialism's bureaucratic structures get out of touch with reality was vividly illustrated in early 2022, when Vice President Kamala Harris tweeted, "Because of the bipartisan infrastructure law, America is moving again. That's what infrastructure is all about, getting people moving." Unfortunately for her, that tweet went out as hundreds of people were stranded for up to 24 hours on Interstate 95 south of Washington, D.C., in dangerous icy conditions. It just reinforced the sense that big government doesn't know what is going on. The entire experience of public health systems breaking down during the COVID-19 pandemic is a clear example of how much big government socialism simply can't deliver the speed and quality that people expect. Any serious analysis of the last 2.5 years since the emergence of the novel coronavirus in Wuhan, China, would illustrate the confusion, lack of information, changing analyses, conflicting advice, and unrealistic rules. Hundreds of thousands of Americans could still be alive today if the public health system were not an obsolete collection of widely differing local organizations and an increasingly bureaucratic, incompetent, and self-protecting federal bureaucracy at the Centers for Disease Control and Prevention, the Food and Drug Administration, the Department of Health and Human Services, and the National Institutes of Health. Compare the difference in death rates from COVID-19 in well-organized countries such as Singapore, Japan, and South Korea with the American tragedy. According to data compiled by Statista, as of February 10, 2022, Singapore has seen a COVID-19 death rate of 154.36 people per million. Japan's rate was 156.62 per million, and South Korea's is 134.66. By contrast, U.S. deaths per million people were reported at a tragically astonishing 2,765.79. The gap in death rates was more than just an East Asian phenomenon. Canada, 934.15, Denmark, 673.88, Finland, 385.12, and Australia, 174.34, all had better outcomes and saved more lives than the United States.